Welcome back to Joy of the Hang, where we go deep, get real, and laugh our way through the beautiful mess of being human. I'm your host, Sharon Stevenson, and today we're exploring something tender, powerful, and far more common than most people realize: eating disorders. Our guest is Dr. Zoe Ross-Nash, a licensed clinical psychologist with a deep focus on eating disorders, trauma, and relational therapy. With years of experience and an unwavering commitment to continued learning, Dr. Ross-Nash brings both expertise and heart to every conversation. Now, before we dive in, I want to say something directly to you, our listeners. If you or someone you love has ever struggled with food, body image, control, or shame, this episode is for you. You are not alone and you're not broken. There is hope, there is help, and there is healing. This is a safe space, and if something in today's conversation speaks to you, I invite you to share it with a friend, a therapist, or even on social media. You never know who might need to hear it too. All right, take a breath, get comfortable, and let's get into it. Welcome, Dr. Nash.
Hello.
Or Dr. Ross-Nash.
Dr. Ross-Nash.
Dr. Ross-Nash,
Yes.
My apologies. Let's start by mentioning some startling statistics that I was very surprised to learn. 30 million Americans will experience an eating disorder at some point in their lives. Is that correct?
That's accurate.
Wow.
Yeah.
9% of the U.S. population, or roughly 1 in 11 people, will struggle with an eating disorder.
Also accurate.
And not gender specific.
And not gender specific. Predominantly women, but all genders.
It's crazy.
Mm-hmm.
Eating disorders, this one blows my mind. Eating disorders are among the deadliest mental health conditions, second only to opioid overdose. Is that true?
Actually, unfortunately, eating disorders surpassed the opioid epidemic recently. So usually eating disorders are neck and neck with the opioid epidemic. And unfortunately, in recent studies, eating disorders have surpassed it.
Wow. I'm sorry to hear that. That's true. Well, we're really going to talk about this. We have a lot to talk about today, a lot to unpack. One person dies every 52 minutes from an eating disorder related cause. I just got chills.
Yeah. It's incredibly deadly.
Wow. Athletes, especially in sports emphasizing leanness, such as gymnastics, wrestling, dance, are at higher risk.
Yes, we call those aesthetic sports, and they are much more at risk than other types of sports that are more related to skill sets.
And I know that one's a little personal for you.
That one,
so
yeah.
We can talk about
it's a
that.
very special community for me.
Social media use is strongly linked to increased body dissatisfaction and disordered eating, especially among teens and young adults.
Mm-hmm.
Okay, so let's just start. What exactly is an eating disorder?
It's a tough question. So I want you to think of eating disorders as an umbrella term. It's really a catch-all. When you think of eating disorders, it can be, I think 7 different types of pathologies. So you have anorexia nervosa, which is the one that a lot of people typically know about. And that is when you're restricting your intake. Then you have bulimia nervosa, which is binge purge type behaviors. Binge eating disorder, which is engaging in binge eating, but there's no compensatory behavior.
Okay, let's stop for a second.
Yeah.
So binge purge means, so if I'm a young adult, binging would mean maybe I wouldn't eat for a couple of days and then I would all of a sudden eat a lot and then I would throw up.
So
is that what that is exactly? Or
bulimia doesn't have restriction in it, actually. So not eating for a couple of days would be qualified as anorexia binge purge type. Okay. So if you are diagnosed with just bulimia or just binge eating is eating 4 times more than what is typically normal in a seating.
Okay.
And then when you are diagnosed with then bulimia, you have to have that compensatory behavior, which would be laxatives, purging, exercise, diuretics.
Okay. All right. And is one more prevalent than the other, or does somebody have both? Can you have both at the same time? How does that work?
So I often see that the eating disorder evolves over someone's lifespan. So what someone might start with anorexia and then migrate into bulimia. However, you usually think of anorexia as the most prominent eating disorder. It's one we see in media most frequently. Actually, binge eating disorder is the most prevalent eating disorder of all eating disorders.
Really?
Yeah.
And what would happen? So how would you recognize somebody that was a binge eater?
Binge eating, think about your Thanksgiving dinner, right? So you're enjoying the meal. Maybe you're eating more than what you typically did in that seating.
We all do.
Exactly.
Thanksgiving,
We're
right?
enjoying food. It's connection. It's about celebration. Binge eating may actually be those similar behaviors, but there's a lot of shame and guilt and secrecy associated with it.
Okay. So they might be doing it in their room late at night.
They might be doing it in the room.
In the car.
In the car after work. And that aspect of secrecy really elicits a lot of shame. And a lot of people associate binge eating with being at a higher weight, but actually that's not always the case.
So if I'm a mom of a young girl, and I am, and what signs would I be looking for with my young daughter to indicate that she might have an eating disorder?
Yeah, and before we even jump into that question, I want to emphasize that you can have an eating disorder at any age.
Okay.
Any age, any demographic, any body size, socioeconomic status, ethnicity, anyone is vulnerable to an eating disorder. It just might look different depending on the community that you identify with. But if you are a mom and you are noticing your child experiencing an eating disorder, you might see them engage in checking calorie counts on food items, or you might see them engaging in what we call body checking. So a lot of folks might measure their wrist with their fingers to see if they can still wrap their fingers around their wrists or their thighs. Other sorts of signs with eating disorders would be having a very restrictive diversity of food. So they don't eat fats, they don't eat carbs. And that would start to be indicative of an eating disorder potentially spiraling.
Okay, so I'm trying to understand this and wrap my head around it so what is the difference between somebody just wanting to lose weight, look good, they're exercising, they are counting calories because they're wanting to lose weight, and it then turning into an eating disorder?
So that is the fine line of all of it, because actually, I think a quarter of diets turn into an eating disorder, which can be really, really scary when you have that significant of a community turning into an eating disorder. So what I always say is the relationship towards the behavior is the most important thing to look at. So if you are interacting with exercise and it is invigorating your life and it is feeling good, and you are eating foods that nourish you, and you are taking care of your body in a way that feels empowering, wonderful. That is values aligned. If you are engaging in those same exact behaviors, but it's making you feel really terrible about yourself, you are feeling not enough by these behaviors, nothing feels good enough, you're not achieving the goals that you're wanting, and you're starting to really spiral into that shame cycle, that's when we start getting into that gray area of this might be pathology.
Okay, so we've diagnosed, okay, we have an eating disorder. Now, what's the next step? If someone comes to you and you've diagnosed, okay, yes, I think you have an eating disorder, what should they do? How do they get better?
It's a very hard disorder to treat. And that's why there's very few specialists. So if you can find an eating disorder specialist in your community, go to a specialist.
Okay.
And you can really find a specialist on the National Eating Disorder Association website, or IADEPT, IAEDP.com, or maybe .org. I can't remember exactly. And these are places that you can find eating disorder specialists. And then once you find a specialist, we call it the dream team, which is eating disorder therapist like me. I'm an eating disorder psychologist. You would want a dietitian, and dietitian, nutritionist can be kind of synonyms, but a nutritionist doesn't necessarily have to go through all of the schooling that a dietitian has to.
Okay.
So I recommend a dietitian, especially for an eating disorder, just because they're a little bit more complex. And then we recommend a primary care physician and a psychiatrist. And that's the dream team of eating disorder treatment, because it's a whole body approach.
Okay. And then you monitor the patient. Sometimes they're hospitalized?
Depending on severity.
Okay.
So there's different levels of care. I have worked at all levels of care for eating disorders, and we have residential or inpatient or hospitalization. And then you have PHP, partial hospitalization programs. And then after that, you have intensive outpatient, IOP. And then you got outpatient, which is what I currently do now, which is once a week type work.
Once a week. Okay. And let's talk about gender. So women and girls are more commonly diagnosed, which we mentioned. About 20 to 25% of eating disorder cases are men and boys. Many go undiagnosed due to stigma.
Yeah. So when you look at the DSM, which is how we diagnose eating disorders, it has a
What does the DSM stand for?
Oh, gosh.
Can you remember? I looked it up the other day too.
Diagnostic and Statistical Manual of Mental Health. So I do have a doctorate in this.
I know. And we're up to number 5, I think, right?
We have 5 iterations, and then we recently released the TR.
All right. So that was your test for the day.
That I passed. So based off of the DSM, it's a very strict criteria set. And unfortunately, it was normed on female identifying folks. And it doesn't necessarily capture what eating disorders look like in men. And it really doesn't capture what eating disorders look like other than young white women. And that's why we have that idea that only women and young white women have eating disorders, because what we think of an eating disorder isn't what's being diagnosed. So actually, I would say all of those statistics that we shared before are probably a lot higher, because we're not able to diagnose people with their actual diagnosis because the criteria set is so strict.
So is an eating disorder only restriction? Because I think of like when you're obese, is that also considered an eating disorder?
It's all about the behaviors.
Right.
So if the person is engaging in binge eating, yeah, they have a diagnosis of binge eating disorder.
Okay.
If they're restricting, then they have a diagnosis more aligned with like an anorexia diagnosis.
Okay. All right. Explain to me how somebody would die from an eating disorder.
Yeah. So most people don't die from an eating disorder. They die from complications of an eating disorder. So cardiac arrest, starvation, liver failure, or organ failure. Because as your body is decaying, essentially, you are dying from complications of the eating disorder and medical complications, which is why eating disorders are so hard to treat, because it requires such a holistic lens.
Yeah, this is a powerful subject. It really is. And I think back to, sorry about that, excuse me. I think back to when I was younger, and I guess I know people probably my age now too that suffer from eating disorders. But definitely when I was younger, I remember. Now I didn't grow up in the age of social media, which I also want to talk about. So I didn't grow up in this era where everyone's posting pictures online and you're being bullied and there's all that. But I did still have this feeling of not being enough and wanting to look a certain way and be pretty and pretty meant to me being thin.
Yep.
Right. And so I do remember, and this is kind of where I got in trouble the last time I talked about eating disorders, but I do want to share that I do remember having the Ipecac in my medicine cabinet and the laxatives and doing those things, those behaviors to make myself look thin. Now I didn't enjoy throwing up, so I didn't do the purging, but I did everything else and would try to exercise. And it didn't matter how thin I was back then. I never felt thin enough. So it wasn't to the point where I had a full-blown diagnosis of an eating disorder, but it would come and go throughout my life for sure. So, and I just think for me, it was about self-worth, value, wanting to be noticed, wanting to be seen, all of that stuff, right? So is that generally what you see when a patient comes to you, just having all those internal messages that are negative?
Yeah, and thank you for sharing that. I think your experience is so common, especially in a lot of young women who are getting messages to be loved, you have to be thin. To be enough, you have to be thin. To be accepted in society, you have to be thin. And usually there was a comment that was made by someone that kickstarted the eating disorder of, oh, if I look this way, I'll be loved. And when they come into treatment with me, it's never about the food. It's never about the behavior. It's about how they feel about themselves. Yeah. So we do a lot of work of improving their self-esteem.
Yeah, I think my trigger, and again, I'll share more personal story. My trigger came in high school when I had been dating a guy. He broke up with me and he dated the prettiest girl in the class, and she happened to be the head cheerleader. And I was not that. I had brown, mousy brown hair. I was on the quieter side. I was not a cheerleader at the time. And, he was an athlete. And I looked at her and was like, oh gosh, I want to be more like her and look more like her. And what do I have to do? Now, I was never overweight, but I still never felt pretty enough. Right. And so that was the trigger for me. It was like, okay, I want to be that girl. Mm-hmm. Right. And that girl just isn't me. I'm the smart girl in the class. I'm the nerd. I'm not I play in the band. I'm the band geek. I'm the nerd. I'm all this, but I was definitely not the pretty cheerleader. So yeah, I've carried that through life. I mean, I'm not going to say that goes away. It did not go away from me.
Right. And that's unfortunately a narrative that we tell ourselves about eating disorders or about our self-worth. And when we carry these stories with us, when we share them, I hope like in this podcast, or people listening to this podcast, knowing that they're not alone in that experience, there's someone else sharing that with you, it gives you a lot of permission to say, okay, maybe I am enough, or maybe that guy was just didn't know what he was seeing, you know?
Well, and the thing that I think I hope I've realized as you get older is it shouldn't just be about exterior experience. I mean, appearance either. I think, people need to value you for who you are on the inside, not who you are on the outside. And so as I matured, obviously that became my, being smart's not such a bad thing. Right?
That's exactly my treatment modality. So I say, hey, okay, appearance is super important to you right now. How can we make other things just as important too? So you become more well-rounded. And if there's ever a threat to your appearance, then it doesn't feel life-ending,
right,
that you lost all your worth.
Right. And I think too, the truth of the matter is somebody's always going to be prettier. Somebody's always going to be smarter. Somebody's always going to be more fit. Whatever it is you're comparing yourself to, you will never be all of it. So you have to really, for me, it's like celebrate your uniqueness, right? Mm-hmm. Celebrate who you were born to be.
Absolutely.
So, and I know, well, let me ask you, what brought you to this field of study?
Gosh, so I was a junior in high school and I took AP psychology, and I almost actually failed the class. I did not do well in it. I was busy doing other things. I was dancing, I was dating. I did not take my studies seriously, but somehow I got a 5 on the AP exam, which allowed me to skip all of the elementary or the fundamental classes in college. So I dove right into psychology. I knew I wanted a major in it. And I remember hearing what a PsyD in clinical psychology was. And I said, that's what I want to do. I was 16 years old. And since then I did that. And then what brought me to eating disorders specifically, my mom had an eating disorder, and she found recovery before I was born. And it is the hardest thing to overcome. So if you know someone who is in eating disorder recovery, that is the strongest person you have ever met. And I could, start crying as we're talking about it. I feel myself welling up. Because the amount of resiliency it takes to find recovery from this, because we are getting so many messages from the society. We have to learn how to interact with food all the time. So the fact that my mom did that, I was like, I want to be part of the world that helps more people do that too.
And just to give a little background on your mom, because I want to explain, we talked earlier about athletes being really more apt to have this disease. Your mom was a dancer, mm-hmm. and now is a world-renowned Pilates instructor. And so dancers, I'm sure when she was young was told she had to look a certain way and be a certain way in order to be a professional dancer, correct?
Mm-hmm. Yeah.
I don't know that culture. Maybe you can explain it a little bit.
It's very unfortunate. So dancers, and I was a dancer, not as professional as my mom was, but I danced all the way through college. But we would hear things like, I can see your lunch, or are you sure your body is ready to be in that costume? Or no, you can't get this part because you don't fit in that costume, or you don't have a ballerina's body. So what is that telling you? I'm not enough. I'm not enough. I'm not enough. I have to shrink myself to be enough in this community. And not only are eating disorders encouraged in the dance community, it's then rewarded. So it maintains. And it ends up causing injuries in these dancers and getting them into really severe health concerns.
Is that still prevalent today, you think, in the dance community?
I would say yes. And I'm a little bit more removed from the dance community, but I recently spoke to an artistic director of a professional company in New York, and he was telling me that they are really encouraging strength over thinness. And actually, that reminds me of something you asked about the difference between eating disorders in men and women. Men have a drive for fitness, where women have a drive for thinness. And that's why the eating disorders look very different in men and women, and why they're not likely to be diagnosed.
So what would a man's eating disorder look like? If they're driven to fitness, that would be a really hard one, I would imagine, to distinguish.
So excessive hours in the gym, using testosterone or growth hormones. Other things might look like couching those macros. And this is very generalized. Yeah. It can look a lot of different ways. But again, it's all about the relationship to the behavior that makes it problematic.
So it has really nothing to do with the relationship to food, or does it?
Yes and no. So getting their protein in, making sure they're hitting those macros. So it could be about.
So I am a big gym rat, and I know many men even in 50 plus who are very, very focused on their fat percentage, their body fat percentage. They might be counting macros. They know how much protein they get every day. I mean, is that an eating disorder though? Or is that really like, I want to have a certain image to maybe be in a bodybuilding competition or,
Yeah,
like,
great question. It's not inherently problematic. Weight loss is not inherently problematic. It's what happens when you don't achieve it. So let's just say you didn't meet your goal for that day. Are you having a full-blown anxiety attack because you didn't meet that goal?
mm-hmm.
And when that is starting to happen, it means that you're interacting with this in a way that is getting concerning.
And I find sometimes it becomes an obsessive behavior. If I miss the gym today, like, yeah, things are, they're not in the right frame of mind even.
Exactly.
Right?
If you can have flexibility, that's the ideal situation.
Yeah. Well, I did bodybuilding for a little while too. And I will say that, for women especially, it is not something that is meant to be a lifestyle.
No, it
Can,
can't.
yeah. And especially for younger, now I'm postmenopausal, but certainly for younger women who have not gone through menopause, it can really be detrimental to your periods and your overall hormonal system. So
Fantastic point. We see a lot of oh my gosh, I can't think of the word right now. A lot of people lose their libido when they're engaging in eating disorder behaviors, and also lose their ability to have children too.
wow, that's scary. That
Very
is so
scary.
scary. So I also read that non-binary and transgender individuals experience eating disorder at significantly higher rates.
They do. So within the eating disorder community, around 1 to 3% of the world experiences an eating disorder. Within the LGBT community, 7% of the community experiences an eating disorder. So that is significantly higher. The way I understand it, especially if there's like gender fluidity or they don't fit in the gender binary, is that they are using the eating disorder as a way to be more aligned with the body that they identify with. So if they
sense.
are assigned female at birth and they are gender binary or wanting to become trans male, they might use the eating disorder to decrease their menstruation because they experience a lot of gender dysphoria when they experience their menstruation. So they use the eating disorder to decrease likelihood of menstruation or to decrease body fat to look more aligned with the body that they're wanting to look like.
Yeah, that makes perfect sense. And I just transgender community, it breaks my heart that they're kind of stuck in this body that they don't feel that they can be authentic in.
Yeah.
And yeah, I'm sure that's part of it. And it's such a complex area. I'm sure that you have to help people through. There's many levels with that. Transgender college students are nearly 4 times more likely to report disordered eating behaviors than cisgender peers. That makes sense what you just said. So by age, most eating disorders begin in adolescence or young adulthood, but there is a rise in midlife and older adult diagnosis, especially among women over 40. Why do you think that is?
So when we look at what is valued in society, it is young women, right?
Yep.
And a way to control their ability to be approved in society. I think that ageism creates these eating disorders in these older women because they want to maintain their youth, because there's a lot of privilege in being young. You get treated nicer. And as you get older, women particularly, men not as much, get shamed and they become less desirable. And if you're not watching, I did air quotes of less desirable.
Well, and they also, I mean, that they say that age group disappears almost, right? Or feels like they've disappeared.
Think about that word, they disappear. Yeah. Well, there's a metaphor there.
Right.
You disappear with your body too. You try to disappear the size. They shrink away.
Yeah. I feel like because I'm above that age demographic, I'm 59. So I feel like that you either shrink or you become bigger, and I don't know if it's all, and again, both ways you're trying to disappear, ironically, right? You still don't want to be seen, but you're not comfortable in your own body. So it's, yeah. And I just think it's tragic. And I wish there was something we could do as a society to change the trajectory of this, because it does feel like it's getting worse. And I think, I blame not the eating disorders, but I blame diets in general with a lot of our body image problems, because I feel like even going to the grocery store, I went this morning and I thought, they always tell you you're supposed to shop on the outside aisles of the grocery store. And I think when I was doing, I'm a wellness coach as well. And so when I was studying, I just became very, very much aware of reading the ingredients on the box and how many oils and trans fats there are in all of our products. And it's crazy to me how convenient food has gotten, first of all, and how uneducated the public is about what they're putting into their own bodies. And I'm always saying you only get one body. Like, to me, it's like, okay, if you have that one sports car that you love, you're going to put the premium fuel in it, right? You're going to take care of your sports car. Like, you've got to think of your body as your sports car, and it should be about health, right? And it shouldn't be about aesthetics. It should more be about what's happening on the inside.
Yeah. How is your body functioning?
To keep your body running at its maximum capacity for as long as possible.
And in my realm, all foods are welcome, and we don't want to moralize any sort of food. And we do need to engage in health seeking behaviors. And that looks like fueling our body with food that has nutrition. And sometimes when we want to have cake, we can have cake.
Right. Of course. Balance. Of course. Yeah, of course. So let's see. Children as young as 5 have been hospitalized for disordered eating. Where does that come from? So as young as 5.
I describe eating disorders as a biopsychosocial spiritual disorder. And when you have the biology, you have the psychology, you have the social environment, and then you have the heart, the spiritual aspect of it. And the biological aspects of it might just be prevalent in as young as 5, and that is devastating to think about. I've never worked with anyone as young as 15, so I haven't personally treated someone at 5, but it is happening more and more frequently.
Is it because of what they're seeing in the home? Is it a parental role model that is saying you can't, maybe they want to get their little 5-year-old into a dance class and they're saying you can't eat the Oreos? Or
it could be all of it. So I know someone who had difficulty latching when they were an infant, and they grew up to have an eating disorder. So that's that biological part.
Right.
And then maybe someone is modeling unhealthy relationship with food and body, and 5-year-olds are witnessing that. So it's a very holistic approach to what's going on.
Wow. And it sounds like no two are the same.
No two are the same.
And then I've got eating disorders affect all races and ethnicities, but are underdiagnosed in BIPOC communities, and I will tell you what that means, due to provider bias and lack of access. So BIPOC, BIPOC, stands for Black, Indigenous, and People of Color. Are you finding that as well?
Absolutely. So that goes back to the discriminatory nature of the DSM, because it's not normed on these communities. There's not enough research on the BIPOC community to really be able to genuinely assess what an eating disorder looks like. And a lot of eating disorder providers look like me. We're white, we're cisgender, and a lot of folks who are BIPOC don't want to come to someone who looks like me, because there are aspects of their experience that I don't understand. I will try my best, but it will be impossible. So it's a multifaceted issue. There's not enough eating disorder BIPOC clinicians, and the DSM is just discriminatory towards diagnosing these folks, which allows them to get health care, or allows them to get care under their insurance.
Interesting. And it says Black teenagers are 50% more likely than white peers to engage in bulimic behaviors, but less likely to receive care, which is pretty much what you just said.
And that's also true within the Hispanic community as well.
Oh, well, yeah, I wonder what other communities, probably several that are not white, right? Caucasian. So we kind of talked about how do eating disorders typically begin, and it could be a variety of reasons, right? What are some common misconceptions about their root causes?
That it's about appearance, and that it's a phase, and that it is a way to be more attractive. And sometimes it starts that way. It very rarely is maintained by that. A lot of times it's trauma that is caused by an external factor that just really rocks their sense of self. So that's unfortunately the misconceptions.
So that plays into the next question, which is what I'm assuming to me, the root would be, what role does control or the loss of it play in the development of disordered eating, and I'm assuming it's a big one.
I did my dissertation on this.
Yeah, perfect. I'm asking the right person. So yeah, that's kind of what I would assume, that it really is about control. So can you
Oh my gosh.
expand on that?
Yeah, I will take an 80-page document and put it to a sentence.
Oh gosh. Well, I won't ask you to do
that. But it's really, so think about it. What is trauma? It is something that is outside of your control that happens to you. And what is a way to get control? How your body is presenting to this world, like what you're actually eating. You get, okay, I can't control that someone did this to me, but I can control what I'm eating today. And then also, these are kind of fought about within the eating disorder community. Folks may use, especially if there's a sexual trauma, they may use the eating disorder to lose weight to appear less sexually attractive and more juvenile, because you're regressing back into a more young body, and people think that will make them less vulnerable to abuse. And same with binge eating, where they gain weight. There's an idea that it creates like a armor of fat against becoming abused again.
Right. It's a shield.
It's a shield.
It's a shield. Wow. Well, you did a good job summarizing 80 pages.
That was my baby.
Yeah. Well, it is a fascinating subject, and I'm sure, again, multi-layered. Yeah. This is another good one. How does our culture's obsession with body image and wellness contribute to hidden or normalized eating disorders? That's a big question.
Oh gosh.
I know.
And it's everywhere. Like you hear comments everywhere. Of, oh, you should get brown rice instead of white rice because it's healthier. Right. Is it? Like, there are so many food rules that are, one, not really backed by science, that we just think that we need to do because.
I like that. Food rules.
Food rules. Yeah.
Is that what you refer to them as? Mm-hmm. Food rules. Give me some more food rules that are.
Don't eat after 7 p.m.
Okay. And yeah, I've heard that one. So how do you feel about fasting or intermittent fasting?
Yes. So not only is it ineffective, but it's a glorified eating disorder.
Okay.
The research has shown that the second you go back to normal eating, you gain the weight. So if your goal was weight loss, it's temporary. It's not going to be long lasting. The only way that I really tell my clients is to either follow a meal plan that is set by a dietitian or engage in intuitive eating, because listening to your body's hunger cues will allow you to find your set weight point, and that will allow you to eat when you're hungry and don't eat when you're not. And we want to be connected in our body in that way.
Exactly. Are there any other food rule myths that you can think of?
This is not a food rule myth, but a lot of people dictate their worth based off of the size of the clothing that they wear. Have you ever gone jean shopping?
Yep.
You are.
I know where you're going with this one.
It's a million different sizes, and none of them are the same. Right. And then
every brand is different.
Every brand is different, and you're a medium in one, and you're extra large in another, or a small in another.
Yeah.
And it really impacts your self-esteem. So just recognize, if it fits, it fits. Like,
yeah. No, that's really good advice, because I'm guilty of that. I'm normally a 0 or a 2, and if it's not one of those numbers, I won't buy it.
Right.
Right. I mean, psychologically, it doesn't matter if the 4 or 6 look better on me.
Right.
If I can't fit into it, I'm going to go home and try to lose some weight and fit into the 0 or the 2. Or right. And it really messes me up when I try to buy a European brand. Right. When those are all, I fit into a much bigger size in the Europe. Mm-hmm. Under the Europe, whatever size model it is. So yeah, that's a good point. I'm glad you brought that up, because that is so true.
Yeah, I call it mental gymnastics with my clients. I'm like, hey, we're doing a lot of mental gymnastics right now. And they're like, oh, I know.
Yeah.
So yeah.
That is so true.
Yeah.
I do it to this day. I'm not happy about it, but I do. What are some red flags people might miss in loved ones who are struggling?
Oh gosh, this is a tough one, because when we love someone and we have a family member or someone who's so special to us, we might be blind to it. So even me as a specialist, one of my friends was struggling, and I didn't bring it up because I didn't know if it was appropriate, or I didn't know if I was reading the signs wrong. What I normally say is, if there's any deviation from their normal behavior. So if they typically are hanging out in the family room, like eating with everyone, engaging in socialization, and then all of a sudden they're eating in their room, or if they're a college student, they're coming to class with their hair and makeup on, or they're in sweatpants and have a stained t-shirt, any deviation from their typical behavior is a sign to just check in. In terms of eating, you might see people like moving food around on plates, or becoming like obsessively adherent to like looking at food labels, or not eating with the rest of the family. You'll see that.
So you just said something that's important. You said you had a friend that had a disorder, but you didn't bring it up. So when would you know to bring it up? That's so, it's such a sensitive topic. It's like if somebody has an alcohol problem, when do you tell them they've had enough to drink? Right?
Yeah.
I mean, to me, there's a lot of parallels between eating disorders and alcoholism.
Huge.
Right?
And there's a lot of comorbidities. We see them happen all the time together. And sometimes for me personally, it's hard because I don't want to be like, oh, the eating disorder therapist who's like seeing eating disorders everywhere, because that can be overwhelming for people. But the best way to go about it is stick with I statements. So, hey, I am feeling this, instead of saying you are doing this. It can people feel defensive. And then sticking to the facts, only saying what you're observing. Don't add your opinion. Don't add what they should be doing. So sticking with the facts and then keeping it brief. You don't want to beat a dead horse. It's already a vulnerable conversation to begin with. You don't want to belabor. So just say what you're noticing, have resources on hand if they want it, like ask permission to give those resources. And if they want to take it, great. And also know if they don't have a positive reaction to this, that is so normal. There's so much resistance to eating disorders that me as a professional who's been doing this for 10 years, I still get bad reactions from folks because it's a scary thing to change.
Well, I would imagine you'd get defensiveness, denial. There's a lot of shame that comes along with it, I would imagine. So yeah, it must be, I would imagine if you were to say to me, Sharon, I'm noticing that you're not eating as much, or I'm noticing maybe that it seems like you're losing some weight. Is there anything that you want to talk to me about? I imagine my response would be, no, I'm fine. Right? No, I'm fine. What are you talking about? I'm fine. I've been trying to lose 5 pounds maybe. Or, I would probably downplay the whole thing and being denial, right?
Very common. So what I would say is just be like, okay, sounds good. If you ever need to talk, know I'm here. And then that's that.
Yeah.
And they know now that someone is seeing them, which is a huge part of eating disorder pathology. While that being seen in that way can be very vulnerable, it's a way to validate their experience. And then also they know that someone is in their corner if they ever need it.
And if it's not about the food, would you maybe redirect and say, what's going on in your life?
Yeah.
Would you maybe take a different approach and say, hey, you know what? I just want to check in. What's going on with you?
I think that's a great way. And just see the human rather than just the behavior.
And not make it about the food. And then eventually maybe they would, get to that place with you.
Yeah, exactly.
Yeah. I mean, especially if you have a best friend, that's somebody that you can, it stays in the vault, hopefully, right? And you're keeping that. That's so important for women to be able to share like that too. We kind of talked about this, can you talk about the difference between an eating disorder and disordered eating, especially in high achieving or parents focused environments?
Yeah. So the difference between eating disorder and disordered eating, think about eating disorder as that clinically significant is impacting their everyday functioning. And then we have a little bit less severe is disordered eating. So maybe they are engaging in restriction, but it's not impacting whether or not they can go out to dinner with their friends. Or maybe they're purging and it's one time a month, but not every week like it would be to have a clinically significant eating disorder. So the behavior is happening, but it's not happening at an intensity that would require significant intervention.
So that would have been me back in college. I would have been maybe disordered eating,
right?
But I didn't have a full-on eating disorder because it wasn't something I kept up.
Exactly. Okay. And duration of time also really matters.
Okay.
But what I say is at any point you can get help for whatever is going on with your relationship with your body.
And to your point, it was never ever about the food.
It was never about the food.
No, it was always about whatever else was happening in my world at that moment.
It's a metaphor often.
Oh, for sure. It was just more of a symptom or a sign, right? Mm-hmm. How important is relational therapy in healing from an eating disorder and why? Oh, I got a little chuckle there. I wonder why.
Well, I am biased as I'm a very
Okay.
relational therapist
Okay.
because
Explain relational therapy. What is that exactly?
it's more about the connection between the client and the therapist. And the reason why I'm a relational therapist is because 90, I'm sorry, it's okay.
Goes off.
92% of reasons why people improve in therapy is because of the therapeutic relationship. 8% is contingent on what type of treatment modality they use. So as long as you have a secure relationship with your provider, you are likely to get treatment outcomes. So I really anchor into that relationship and honestly create corrective experiences for folks that maybe their mom never validated their experience of it, and now me, a significant person in their life, can validate it for them, and then they can begin to validate it for themselves. There are frontline treatments for eating disorders. CBT is one of them. I'm trained in CBT. I use it when necessary. Another one is FBT, family-based therapy, and these are fantastic modalities. I integrate them into my work, but I personally think the relationship is most important because eating disorders are a disorder of disconnection. You're disconnected from yourself. You're disconnected from your internal cues. So if we can build a relationship with yourself through our relationship, so many things could happen.
That's great. So how long would somebody normally work with you in a relational therapy type environment?
I've been seeing my clients for anywhere up to a year to 3 years.
Okay.
So it's a long relationship. And most of my clients came in with significant eating disorder concerns. And what we say is once the eating disorder stops, the real work begins. So, okay, why did we develop? Now that we've stabilized behaviors, why did we develop an eating disorder after that? What was going on with myself that made me vulnerable to this experience? And that being said, therapy is not forever. I just developed, since it is a more relational approach and it's more long lasting, the treatment takes a little bit longer.
Of course. For those in recovery, what does progress look like just beyond just weight or food?
Freedom.
Freedom. Oh, I like that word.
Yeah.
It looks like freedom. Mm-hmm. Freedom to do what?
Wear a bikini.
Oh.
Freedom to go out to dinner with your partner. Freedom to buy the clothing that actually makes you feel good rather than what you think you should be wearing. It looks like eating.
You're going to make me cry. I just love that.
It's the most special work on the face of this earth. Yeah.
Oh, that's beautiful. I can see why you do it.
Yeah.
Wow. What are the emotional needs often driving restrictive behaviors, binging or purging? Connection, you said.
Connection.
That's one. Are there any others that you can think of?
So there's something called like eating disorder behaviors, we call them EDBs. But then there's emotion-driven behaviors too. And oftentimes we are eating in response to an emotion. So we are or not eating. So we are restricting because we're sad and we can't tolerate that really intense feeling of sadness. We are binging because we are angry and we want to punish someone and we can't punish the person who hurt us. So we're going to punish ourselves. So a lot of the behaviors of eating disorders are driven by emotion. So if we can learn to understand, integrate, tolerate emotions, that is going to be so helpful for these folks.
Awesome. Let's go back for a minute and talk about the role that social media plays today in eating disorders. Can you tell me a little bit about what you're seeing in the field right now with TikTok and Instagram and everything else? It's a lot of exposure.
Yeah, so I wrote a paper on this a couple of years ago, and we actually saw that the longer someone spends on social media, the more likely they are to develop eating disorder behaviors, just by looking at different sort of bodies on your feed. Mm-hmm. Unfortunately, with TikTok, we see trends like skinny talk, where we are glamorizing eating disorders and we're romanticizing it, and we're seeing it as a good thing rather than something that could be very, very harmful to folks, especially if they're not being monitored by a dietitian or a physical trainer or a personal trainer that knows how to take care of someone's body. So we're getting these influencers who are sharing tips and tricks of an eating disorder, but they're masking it as wellness. And a lot of these things are just spiraling out of control.
So what can we do as a society, to normalize our body image, and to not make it a fantasy, some sort of fantasy, because none of that's real, right? I mean, that's what, I mean, I know everyone's trying to have this certain look or whatever, but it's not real. And I think that, is there anything that can be done at the school level, or, because I'm only bringing this up because still most of it starts in adolescence with young women. So what can be done early to prevent this from starting?
You are onto something really important. So early intervention is going to prevent eating disorders, period. There's no other way about it. If we can teach young people, young women, children, how to interact with their body, how to understand their hunger and fullness cues, how to find value in things outside of their appearance, if we can have them learn what an eating disorder looks like at such a young age, it'll prevent it in the future. I am a living proof of that. So as long as I can remember, my mom was talking about her eating disorder and how she found recovery, and encouraging me to explore different aspects of food and my body, and have a good relationship with my body. I never developed an eating disorder, yet I had all of the warning or the potential predispositions to develop an eating disorder. The genetics were there. I was a dancer. I'm high achieving. I'm a perfectionist. And yet I didn't develop an eating disorder. Why is that? Because we were talking about it. So if we can start talking about it, we are going to save more lives. And if more people can listen to this podcast, we are saving lives.
Well, it's such an important topic. It honestly is. And, I don't think there is a girl on this planet who has not gone through some level of this in one way or another.
Absolutely.
Because I don't care if you are the prettiest girl in the class, you are still having these feelings of not being enough, self-doubt, all of that, right? I mean, it doesn't matter. So, if you're looking in the mirror and thinking you're not the prettiest like I was when I was young, everyone's thinking that at that age. We all want to be something we're not, right? I mean, I just think it is important that there's education, and also there needs to be education, I would imagine, around how to interact with social media in a safe way and in a positive way that isn't so, I don't know what the word is, but doesn't hurt your psyche so much, like block those pages or something, right?
You can block them. You can go into your settings and take away certain words. So for example, I don't have any words on my Instagram associated with detox or weight loss or skinny talk. And that filters out a lot of that.
Oh, I didn't know you could do that.
Yeah, just go into your settings and you can decrease.
On all the different platforms?
I don't know about TikTok. You can do that on Instagram and Facebook, the Meta apps.
That is great. All right, everybody, block that stuff. What message do you wish every person struggling with food and body image could hear right now?
My gosh, there's a life outside of it. It's so encapsulating and you get so trapped in it. And I remember the first time one of my clients had a day where she was like, I didn't think about me in this negative sense. And for the first time, she was like, I was able to just be me. I was able to just enjoy life. And I wasn't trapped in thinking of, well, I ate that at that time. I ate this at this time. We're going to eat this later. We're going to have to, so that means I have to do X amount of exercise here. And she wasn't doing all of that. And she was like, I was just able to sit with my husband and enjoy vacation together. And she was like, this is the first time I actually lived.
Oh, that's beautiful.
Yeah.
That is beautiful. Great work that you're doing. All right. Dr. Zoe Ross-Nash, I have one final question.
Okay.
I kind of gave you a little preview before we started. What is the advice that you would give your younger self?
Gosh, I was not the smart one, as we talked about before.
I don't know if I believe that. I don't know if she's got her doctorate. She's 30.
that was not something that I believed about myself at the time.
Okay.
And I just did not think that these things were possible. And my favorite quote is, you can do everything, just not all at once. So if I could just say, hey, Zoe, slow down. You're 16 years old. It's okay. Take your time. That you will achieve whatever you want to achieve as long as you just give yourself the time, and you'll get there.
I think that's beautiful. It reminds me of a podcast I just listened to this morning too, one of Mel Robbins' podcasts, and they were saying the same thing. And she's interviewing somebody who has a blockbuster life, but he didn't start out that way.
Right.
And he said, everything will come in time if you just don't give up.
Try again.
Try it again. Just one foot in front of the other, and one day at a time.
Yeah.
Right. Thank you so much for being
Thank
here.
you. This was incredible. Thank you so much for the work that you're doing, spreading this.
Thank you. And actually, we should end with one last thing, and maybe you can help me with
Sure.
this. If anybody is struggling with an eating disorder or knows somebody who might be, where should they go for help?
Yeah, so the National Eating Disorders Association is a great place to just start. There's toolkits for parents, loved ones, coaches. The International Association for Eating Disorder Professionals, IAEDP, I mentioned that earlier, is a great resource. Eating Recovery Center has a lot of different free groups. So does the Alliance for Eating Disorder Network. And then I also provide services virtually to 43 different states. So if you are looking for a referral or to work with me, feel free to contact me and maybe we could add that into the show notes.
Yeah, and you also have a website.
I have a
And
website.
how do they get in touch with you via your website?
www.drzoerossnash.com. So just my name and www. So I have a lot of resources on there as well that can help you get connected to a professional if not me.
Well, thank you again so much for being here today. And please, if this spoke to you in any way or you know somebody that's struggling, please share this with a friend. Help us spread the message and spread the word and get help for people that may need it. So we want to support each other and have a loving whole society. So thank you, everyone, for being with us.